If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, what is diabetes and how is it cured? Answer by Saida Hajiva. Is diabetes curable? Both type 1 and type 2 diabetes cannot be cured. Medicine for the treatment of diabetes is not yet found, but diabetes can be remission by taking treatments and changing lifestyle. Diabetes mellitus is not a threatening disease, but its density is increased through worldwide. Persons from 6-month-old to 80 ages are having diabetes disease. Type 1 or type 2 diabetes has been caused because of the insufficient insulin production or insulin resistivity in the body. Many studies are going on. The progress of the diabetes cure is medically proven. Diabetes can be curable. Urbanudrin. Recent advanced research for diabetes by American Diabetes Association is June 19, 2015. Diabetes research has done, which is a pathway to stop diabetes, generates smart insulin patch. It is research based on the artificial pancreas smart insulin by using nanotechnology to produce insulin to the response of high blood glucose level. June 31, 2015. Aerobic exercise improves brain function for people with prediabetes to avoid Alzheimer's disease because they have memory loss problem. August 7, 2015. Study uncovers potential new ways to prevent beta cell death in type 2 diabetes. This study preserves beta cell function in the pancreas. March 1, 2016. Based on the link between stress and diabetes. January 2018. Research was patients who living with diabetes can take aspirin every day to balance normal blood glucose levels, high blood pressure. So researchers have been continued their research on diabetes cure. Still, one constant solution to cure diabetes is not yet found, though diabetes types may be type 1 and type 2 can be remission. Type 1 and type 2 diabetes can be managed by the treatment and lifestyle. Diabetes treatments and methods. Weight loss surgery. People go for weight loss surgery to skip the signs and symptoms of diabetes. Diabetes remission will happen to them, which means diabetes remission is a break of high glucose level for a certain period. It does not show any symptoms of diabetes. So people who had weight loss surgery do not feel the effect of diabetes. Weight loss surgery is a gastric bypass surgery, which is the operation of placing a band around the small intestine to make it as a small pouch for less food intake. Surgery can give only the short-term remission for diabetes. Diabetes may occur at any time in their future life. Is medically proven. Diabetes can be curable. Urbanudrin. Diabetes remission takes us two ways. Partial remission. Person got normal blood glucose level as much as a person without having diabetes for 6 months to 1 year. Complete remission. Low blood glucose level for 1 year, not even having pre-diabetes symptoms. Islet transplantations. Islet, pronounced as illet, is a cell cluster spread through the pancreas, contains more cells for, say, beta cells. Beta cells are produced, restore, and release insulin in the pancreas to take as energy for the body. Islet transplantations have been taken by the diabetes patients. Cells are to be transplanted by getting the donor cells which respond to the blood glucose level. This transplantation is protected from another complicated disease too, like heart diseases, eye damage. Pancreas transplantations. Pancreas transplantations are the surgical procedure for pancreas transplantation from a healthy donor. This pancreas replacement is needed for the persons whose kidney attained failure stage. This helps insulin in response to high blood glucose level, and the doctor would suggest for few medications to follow up. Tips. Use best herbal supplements for diabetes with your food rather than preferring surgery with food, and lifestyle is the best way to cure diabetes. Ages of diabetes. According to the statistical report for the past 3 years, the estimation of the age of diabetes is predicted that diabetes has spread from infants to 70-age persons. American Diabetes Association recommends the screening tests for the Americans who crossed 45 ages. About 25% of people who have above 65 ages have diabetes, included diagnosed and undiagnosed. 85 million people who have 18 ages have prediabetes in the U.S. Age 20 to 40, nearly 3.5 million people have diagnosed diabetes. Both type 1 and type 2 diabetes would cause due to family history and obesity, stress, lifestyle, and gestational diabetes. Age 40 to 65, nearly 8 million people have diabetes. Due to high blood pressure, high cholesterol, lack of insulin. 65 to older, nearly 4 million people have diabetes due to obesity, blood pressure, bad diet, Insulin production completely stopped. Every year, nearly 1 million Americans diagnosed diabetes. In 2015, 79,000 people were died because of diabetes. Source is medically proven. Diabetes can be curable. Urban Udrin. Answer by Josie Randolph. Diabetes is a metabolic disease in our body, due to metabolic disorder due to the complete or relative deficiency of the hormone called insulin. The amount of glucose in the blood increases, and once it comes out with urine. This overall condition is called diabetes. This disease increases the amount of glucose in the blood. Lasting. The amount of glucose in the plasma of healthy people is less than 5.6 milliliters in the free state, and the food is less than 7.8 milliliters after 2 hours. Glucose level of glucose in the plasma of the blood, or 2 hours after eating 75 grams of glucose, is believed to be diabetes if blood glucose levels exceed 11.1 milliliters. Insulin resistance key. Insulin resistance is a physical condition where the body is made of insulin, but that does not work properly. That does not reduce blood glucose levels properly in the body. If a person has insulin resistance in his body, then his diabetes occurs, usually type 2 diabetes. Insulin resistance usually increases the level of glucose in the blood. There is confusion. The brain develops, the weight increases. Fat accumulates in the body, blood pressure increases, hunger and thirst increase more than normal. Diabetes symptoms. A. Frequent urination. B. Too much thirsty. C. Getting more hunger. D. Weight loss despite eating enough. E. Feeling tired and weak. F. Delay to wound dry. G. Skin disorders such as scabies, boils etc. J. Visually less visible. The way to diagnose diabetes. Diabetes is diagnosed by measuring in 1% of blood glucose levels. The amount of glucose in a healthy person's blood plasma is less than 6.1 milliliters of free and less than 7.8 milliliters of meal after 2 hours or 2 hours after eating 75 grams of glucose. The amount of glucose in the blood plasma is less than 11.1 millimole. Glucose is 0.06 milliliters or more in the blood plasma of any person in 2 hours after eating food, or 75 grams of glucose. Blood glucose amount of 11.1 milliliters or more in blood plasma, or more than 1.5% of blood donation if more. He is diagnosed as a diabetes patient. The types of diabetes and their differences. Type 1, 2. Type 2, 3. Pregnant diabetes. 4. Other specific reason class. Type 1 in such patients, insulin is not completely made in the body. Usually this type of diabetes is seen at 30 years of age. These patients have to take insulin injections to control diabetes. Otherwise, blood sugar has increased rapidly, and soon after the death of anemic poison in the blood, it becomes unconscious. Type 2. The patient of this class is mostly 30 years old. Nowadays, this number of patients are being seen under 30 years of age and growing day by day. Insulin is made in their body. However, if insulin injection is not necessary, they are not poisoned like type 1 patient. That is, they are not dependent on insulin. In many cases it is possible to treat them with dietary changes and regular exercise. Pregnant diabetes. Maternal diabetes is often diagnosed during pregnancy. Diabetes is not present after delivery. This type of complexity is called pregnancy diabetes. Pregnant women can be dangerous for both pregnant women and pregnant babies if diabetes occurs. In order to avoid danger, it is important to keep in control under insulin during pregnancy. Other specific reason class. A. Genetic reasons are low in insulin production. B. Decreasing the effectiveness of insulin for genetic reasons. C. Pancreatic diseases. D. Lots of other hormones. E. Medicines and chemicals contact. Reasons to diabetes. Anyone at any age can be infected with diabetes at any time. However, the following people are more likely to develop diabetes. A. Those who have a family of particularly related parents or blood related to diabetes. B. Those who have a lot of weight, GHT, and who do not do any work of exercise or physical work. C. Those who have used cortisol drugs for a long time. D. Women who had diabetes during pregnancy, women who gave birth to over 9 pounds. E. Those who have blood pressure and cholesterol in the blood is high. What is maternal diabetes? Diabetes is diagnosed after pregnancy and after delivery. The amount of glucose in the blood becomes normal. She is known as maternal diabetes. In pregnancy, the mother's body needs more insulin than usual to keep blood glucose normal. If the body is unable to produce this insulin, then the pregnancy of the pregnant mother increases the amount of glucose in the blood during pregnancy, that is, maternal diabetes. Placental hormones are also responsible for maternal diabetes. What kind of complications can be triggered by diabetes? Paralegal nervous system complications, cardiovascular disease, deleterious wounds on the legs, exposure to urine, and subsequent kidney failure. Thin dishes, tuberculosis, inflammation of the gums, itching, boil, scab, etc. Moreover, due to the disease, the decrease in sexuality. Women are more likely to be born with birth weight, birth of a baby, premature birth, child mortality after birth, and various types of birth defects. What to do in the management of diabetes? There are 4 rules in the management of diabetes. 1. Food system. 2. Sufficient physical work and exercise. 3. Medicines. 4. Diabetes education, food arrangements. If diabetes is to follow a specific dietary regimen, the main purpose of keeping food rules is to keep diabetes under control and to keep healthy. Food adoption policy. A. If the weight of the body is too low or less than it is normal, to increase and maintain it if it is normal. B. Sugar. Sweet foods are excluded. C. Eat some sugary foods and eat it. D. Eat more of fennel foods. E. Eat less saturated fat and practice intake of unsaturated fat. F. Eat quantity of calorie foods. G. Eat food at certain times. J. Do not miss eating any food. Yes. Today is not less, eat more like this. Sufficient physical work and exercise. The role of exercise or exercise in controlling disease is very important. Exercise or physical exertion helps in the movement of muscles and helps in movement of blood. The body is healthy as a result. The effectiveness of insulin increases. The body will be healthy enough to walk at least 30 minutes and at least 5 days a week. Medicines. All diabetics have to follow food, exercise and discipline. Due to the proper condition of elderly patients in particular, the disease comes under control. But type 1 diabetes patients need insulin injections. Type 2 diabetes patients have to use food pills and insulin if needed. Education. Diabetes is a lifelong disease. It is possible to keep the disease in full control if proper action is taken. Therefore, for the treatment of this disease, patients need diabetes as well as education, as well as the relatives of the patient should have knowledge about this disease. Because there is no alternative to education. Read more. How to lose weight at home. How to lose weight fast in 2 weeks. Workout routines for beginners. Psychological benefits of exercise. Workout at home without equipment. Answer by Jagalki. This could be a long answer, but I'll try. There are different types of diabetes, typically called type 1, type 2, type 3. Type 1 diabetes has the dubious honor of not having a known cure at this time, so your second question can only pertain to other types. Type 3, 4, 5, 6, all have unique characteristics, like maybe diabetes that only affects the brain or only the thin elderly or something. Not all of these types have been accepted, and are not a mainstream type. This leaves us with type 2 diabetes, also known as onset diabetes and insulin-resistant diabetes. It has also been called the silent killer. The type 2 diabetes, referred to as non-insulin dependent diabetes, is a disease that manifests itself when your cell walls block glucose, energy, from entering. Insulin, produced in the pancreas, acts as a key to open cell walls and let in the glucose. When insulin fails to open the cells like normal, you have insulin resistance. Another type 2, so if your pancreas doesn't make enough insulin, there isn't enough to go around and your cells don't get enough glucose. When either of the above conditions exist, your blood sugar levels go higher. So you can see the importance of insulin when it comes to regulating the energy in your body. Insulin also supports healing after injuries by delivering amino acids to the muscles. When blood sugar levels are too high, the kidneys produce more urine in order to flush out the excess sugar. And excessive sugar can strain the kidneys as well since they have to work harder. Another type of diabetes that arises from insulin resistance happens only to women. When pregnant, women may get gestational diabetes, which has symptoms similar to type 2 diabetes. Gestational diabetes usually goes away after the baby is born, but it is considered a risk factor for later development of type 2 diabetes. As of today, there is no drug or man-made medicine that will cure your diabetes. The only way is through natural methods. I spend a great deal of time researching the question of a cure, and have found at least 30 diets that claim to help you overcome your diabetes. I also know of 7 different ways to cure your type 2 diabetes naturally, including my way. All 7 have at least 2 things in common: diet and exercise. So my answer is exactly that. Start with diet and exercise. I have written a number of articles that you may find quite useful in getting started with your cure, but I should forewarn you that you may have to make some basic lifestyle changes. Eva included a link to my articles below, in case you like boring reading. Diabetes Free by Nature, the all-natural way to cure diabetes.